So what is laser proctology? Let's absolutely start from there.
Traditional methods, what was happening was we had to cut, tie, do stitches.
Yeah.
There was a big wound that was left behind. Now what has happened with laser is we're avoiding all this.
कई बार ऐसा होता है ना कि हल्का सा दर्द हो हम डॉक्टर के पास पहुंच जाएंगे तकलीफ हो I'm saying what are some signs that one must look for जहाँ पे उनको उनकी बॉडी बताती है कि हाँ it's time to visit a doctor, but when is the right time to visit a doctor also?
These days what I'm seeing is 75 to 80% of patients that come to me, if they see a small mass, if there's like an itching or burning, they just come with the diagnosis, I have piles. That's not true. There are other conditions that can cause these.
What should one do on a daily basis to avoid reaching a point where it starts hurting them?
People don't understand when they have a long sitting hours. It is the beginning. You are inviting piles, basically. Okay, so it's not a good thing. So get up after 1 hour, take a walk around in that area, and then again get back to work. It's okay. Second thing, what I believe is for everyone, you should put a big board of no mobile phones in bathroom.
Oh, that's so difficult.
Yes.
So difficult to do.
It's very important because these are very small things, but it's going to help you in the biggest possible way.
All kind of information
Yes.
that you get on the internet, people build on that, go deep, and then they come to you and then try to consult you.
So that's not right. People need to understand that correct advice will be given only by a medical professional, which is why if they are suffering from anything, either consult a medical professional immediately, or if you have someone known, then definitely reach out to them.
Hi everyone, welcome to the next episode of Beyond Medicine, a podcast by Rising Medicare Hospital, Pune. In today's episode, the doctor that we are hosting is Dr. Simran. She is a consulting doctor at Rising Medicare and she's a specialist in laser proctology. Now, what is laser proctology? How does it help? How is it different from traditional surgery or traditional surgical methods? And what is the long-term benefit for patients, who are going through piles, fissures, fistulas, all of that? All of that is covered in this episode, of course, but beyond that, Dr. Simran also shares what are some small lifestyle changes that you can do on a daily basis to sort of ease out. Number one, avoid getting to a point where you need medical assistance. And then number two, even if you have some sort of discomfort developing, these daily lifestyle habits and changes can really ease out some of that discomfort, right? And then, of course, the role that internet is playing in all this narrative that also is being discussed about. Most importantly, what is Rising Medicare Hospital doing and what is Dr. Simran doing to make sure that the patients visiting her are comfortable, their journey and if at all there's a need for a medical intervention or a surgical intervention, their journey is comfortable there. And then what happens post surgery. So these and more similar topics and pointers are discussed in this a little longer conversation. Don't forget to stick around till the end and do share it with someone and everyone in your network who may really help, who may really use this knowledge. It'll really help them come out from their discomfort and their problems. So stick around till the end. Let's go and talk to Dr. Simran.
Okay.
Welcome, Dr. Simran. Thank you for your time. So before we get on to understanding more about your domain, your area of expertise, and typical basic myths and facts of the specialization that you operate in, I'd love to know more about you. How did your journey start? And in a very small frame of words, if you can also help me know more on why did you decide to choose this specialization specifically?
So, well, first of all, thank you for having me here and giving me the opportunity to speak on this topic. So, my qualifications are MS in General Surgery and Fellowship and Diploma in Minimal Access Surgery. So, today the topic that I wanted to speak upon was laser proctology. So, it's important to understand why laser proctology comes into minimal access surgery is that there are many advancements that have happened since traditional methods of operating into proctology surgeries. So it's important to understand why proctology is becoming a big hazard, and people take it as an embarrassing topic to talk about.
Correct.
And they're not very keen on opening up to that topic, and then they sit with the situation and then they silently suffer, which is not really a good scenario. And it's
Correct.
very important for people to understand why it is important to even consult or seek a medical help in such a scenarios, because something as small as a constipation could be something as a fissure or could be more complex as a rectal cancer.
Correct.
So it's very important for people to understand at what stage you have to consult or seek a medical help, which is why I got into proctology. And since there are many recent advancements going on in proctology, so it's important for people to understand what are the traditional methods of operating every particular case, and what are the advancements that are happening and how they are helping people. So it's very important for people to know at what stage of a disease they are and what can help them.
So, what is laser proctology? Let's absolutely start from there. I don't understand anything about it.
Okay.
So, explain it to me that I am a 5-year-old guy,
Okay.
a 5-year-old kid. I don't know anything about laser proctology. What is it? How does it work?
Okay. So laser proctology, basically what it means is, in layman's terms, it's basically that I'm going to fix your problem without turning your life upside down. As simple as that.
That's as simple as it can
It's
get.
as simple as that. Okay, so laser energy is something that has been developed, and it is honestly a boon to everyone, patients as well as doctors. So it is a focused laser energy that operates on a particular disease that you need operated. So it's not going to cause any of the additional surrounding tissue damage. So if I'm operating only on piles, that's the only disease that it's going to focus on. If I'm operating on fissure, it's only going to focus on the fissures. So basically there's no big cuts, there's no big drama that's going on. So it's just clean and precise surgery that happens, which is why laser surgeries are advancing more and more.
Yeah.
Yes, and it's important for people to understand when and why they require these laser surgeries.
One thing is that you mentioned that it's minimal access,
Yes.
no cutting, no cuts.
Yes.
What besides that? Why is it so important?
Okay, so minimal access basically is a very wide umbrella term. Okay, so everything comes under minimal access, such as laparoscopy, thoracoscopies, robotics, something called as nodes. So that's basically natural orifices entrance. So that is a completely scarless surgery. So that's still developing in India. A lot of celebrities are getting into those surgeries. So when you come to proctological conditions, so we have laser surgeries, which comes under the umbrella term of minimal access surgery. So with traditional methods, what was happening was we had to cut, tie, do stitches.
Yeah.
There was a big wound that was left behind. And since anal region is such a sensitive area, when you have a big wound, it's an absolute discomfort to these
Correct.
patients.
Yeah.
They cannot sit, there is burning, there's pain constantly, no matter how many medications they are taking, it's just constant pain.
Correct.
Even after 2 weeks of surgeries, they come back to us and say, okay, there's still pain. They can still feel some swelling, which is
Correct.
basically, yeah. So that's basically the inflammation that is post-operative. Now what has happened with laser is we're avoiding all this. So there's no cuts, there's no bleeding, there's no inflammation. So there is very less post-operative pain in this. There is going to be pain. This is a very important thing that patients need to understand.
Correct.
Because patients come with a mindset that, okay, it's a laser surgery, I'm not going to have pain because, it's the best thing that's going on these days. No. People come with a mindset that, okay, there's not going to be any pain, there's not going to be any bleeding, I'm going to go home all happy and dancing. Yes, you're going to go back home early. That is a very, very big advantage with laser surgeries because there is less hospitalization stay. So either you can get it operated in daycare surgery, that means you go back home the same day, or it's just one day stay at the hospital. Now, why it's important for people to understand is when they come with a mindset that, oh, I'm going to be operated by a laser, there's not going to be any pain. So what happens is any intervention in your body is going to give you a little bit of discomfort, is going to give you that pain. So as soon as the anesthesia effect is off, they feel that little pain, and then in their mind it just jumps, oh my God, I have a big pain right now. So that's not right. People need to understand that in comparison to the traditional methods, the pain is relatively less. it's going to be there, but it's very, very less. So it can be dealt with just basic analgesics. You're not going to need higher doses of medications for that. So that's very important for people to understand.
What are some early signs one must look out for before deciding to visit a doctor?
Okay.
And while watching those signs, what are some timelines, if at all there are, that they must follow? कई बार ऐसा होता है ना कि हाँ, हल्का सा दर्द हो हम डॉक्टर के पास पहुंच जाएंगे, तकलीफ हो रही है.
Yeah.
But then I'm not focusing on self diagnosis.
Yes.
I'm saying what are some signs that one must look for जहाँ पे उनको उनकी बॉडी बताती है कि हाँ it's time to visit a doctor, but then when is the right time to visit a doctor also?
See, when it comes to proctology, there is not one correct time to go to a doctor. Okay. Because if I say that statement, then every patient has their own disease. Every disease is different for them because they come at different stages.
Correct.
But it's important to understand that, okay, I have constipation. I've been having constipation for say over 6 months now. It's not normal.
natural, yeah.
Yes. So that is when you have to seek medical help. Now, constipation basically, as per me, is the mother of all diseases.
Okay.
Okay. So constipation is going to cause fissures, it's going to cause piles, and then people don't understand because they just assume that, okay, it's just constipation and I'm just going to treat it with my home remedies. But then it's not going to solve by itself. Then these complications start to arise. People start to have burning sensations while passing stools. Sometimes they notice small amounts of blood in the stools. It can be a fresh blood. Sometimes they see there is a small swelling. Sometimes there's itching. So, and these days what I'm seeing is 75 to 80% of patients that come to me, if they see a small mass, if there's like an itching or burning, they just come with a diagnosis, I have piles. That's not true. There are other conditions that can cause these. So, but I believe that if you have a small amount of pain, even at sitting long hours, or there's a discomfort for you to sit for say more than 1 hour, okay, or if there's a long-term constipation going on, then definitely you have to seek medical help.
Let's go one step पीछे यहाँ से.
Okay.
One more step पीछे. So a lot of the work that we do in today's time is a sitting desk job.
Yes.
People sit.
Yes, yes.
So that reduced motion, reduced body motion has created a lot of problems.
Yes.
Right? Constipation being one of them.
Definitely.
And the subsequent results thereof. What should one do on a daily basis to avoid reaching a point where it starts hurting them badly?
Okay. This is a very good point because you see the work culture around us these days. Okay, it's either work from home situations or the new concept of working 70 to 80 hours
My God, yeah.
a week.
Correct.
Some people even say that they want to work on Sundays. So when you're working on your laptops, especially the IT sector that you see, they're working on their laptops. They're sitting for 70 hours in a week. It's not a good scenario because it's going to slow down every function in your body. Okay,
Correct.
so when the GI motility reduces, obviously it's going to start causing constipations. And when these people are on their laptops, they're just sitting, it turns into more of a sedentary lifestyle.
Correct.
Then consumption of water is extremely less. They do not hydrate themselves well. Their hydration drops down to say 1 to 1.5 liters a day, which is obviously not sufficient for any body.
And that's mostly unconsciously.
Yes.
People have not built a water drinking habit in their conscious.
Yes, I had seen people actually having notifications, the app notifications reminding them that they're supposed to consume water. Hanji, pani piyo. So they're supposed to consume water. I feel if you're trying to train your brain in this way that you're supposed to consume water every hour, it's a good thing, but do not obviously keep it as a lifelong habit. You're supposed to, subconsciously, you're supposed to make sure that you're drinking that amount of water. Because again, it comes down to the same thing that for a healthy stool to be formed, it's going to require water.
Correct.
And it's going to pull out water from your body. And if there's no water content in your body, what is it going to pull out? So again, it's going to start causing hard stools, Patients are going to end up with constipation, and further on, these conditions begin. Second important thing that has happened is whenever you're working for long hours, you do not take care of your eating habits. It's
Yeah,
it's
absolutely.
either junk food or it's just some outside food that's going on. Even at home, you have like a lot of munchies going on. You're just munching on chips and everything fried and maida. So your fiber intake reduces. Nobody's gonna munch on a salad. That's very, yes, to
Not a
be very
preferred
frank,
choice.
not a preferred choice. Nobody's going to do that. But of course, you can pick up on healthier habits. You can take up black chanas for munching, but it's a very rare habit that people actually take onto. But people are moving towards these junk consumptions more. Because of this, their eating habits are going poor. So again, it comes down to the same thing, that it reduces the GI motility, it causes constipation. Again, it's going to start forming, it's going to start to these conditions for all the proctological diseases. So sitting down, sedentary lifestyle is a very, very big impact on such conditions. So for this, I believe if you're working, it's okay. It's your job.
Correct.
Yes, your job. You have to work for 70 hours. You have to work for 70 hours. There's no answer question in that. But again, if you're doing that, then make sure that every hour you get up, you at least walk around in that area, have some sort of movement. I'm not saying, okay, take a pause every hour and then, take a break, go have tea, coffee. No, you can walk around in that area or have a standing desk. You have so many options these days. Have a standing desk. At least you're not sitting down constantly. Now, big issue with proctological conditions is that, especially in situations like piles, people don't understand when they have a long sitting hours. It is the beginning, you are inviting piles basically. Okay, so that is one situation that people need to understand, because the more you're sitting, because of gravity, there is so much of effect. You're inviting piles to your body. It's not a good thing. So get up after 1 hour, take a walk around in that area, and then again get back to work. It's okay. Second thing, what I believe is, for everyone, you should put a big board of no mobile phones in bathrooms.
My God, yeah, talk about it.
Definitely, you should do that. No
I
cell
think
phones.
that's a grieve habit that has been building up, right, in
Yes.
the day-to-day life of people.
Yes.
Almost everyone does it. It's become like
Almost
a muscle
everybody does
memory.
it. Now, okay, if there's a person who has to sit on a toilet for 30 to 40 minutes, if they've built up this habit, it's wrong. If they're genuinely constipated, you need medical help.
Yeah.
Okay, but if you're building up as a habit, it's definitely a big problem for you, because when you're sitting in that position for such a long time, there is a bearing down effect.
Yeah.
Okay, so when you have that bearing down effect, it's going to cause more pressure and it's going to dilate those blood vessels even more, which is then going to form piles. So definitely every person should just have a big board, no cell phones in my toilet. You should do that. Because this habit has to stop. It's not a good habit. And people, because of that, then they go and they start looking at reels, they start watching some of the other videos, and then it does not stop. Because then your brain goes into that training function that, yes, the brain starts asking for more cell phone, more reels. So then you get into that habit. And then you are going to come to us with such issues. And then with such people, they suffer silently for a very long time. They feel very awkward, they feel embarrassed to talk about this, because first thing, because of the location. Second thing, there is pain, but they don't really understand how to ask for help.
Correct.
So it's important for them to understand what is causing the problem.
Pain.
And if at all you are actually starting to see that, yes, I am at the beginning stage, definitely, if you come earlier to us, we solve your problem the fastest.
Correct.
But the later you come, it's going to be a bigger complication. So obviously, we won't be able to take these measures, and then we will have to go to the traditional methods, which is going to give you more pain.
I want to build on that point, Dr. Simran. Okay,
Yes.
there is a little bit of discomfort. Whatever habits that we've spoken about, irrespective of that, there's a little bit of discomfort. Starts turning into slight pain, then it turns into a perpetual pain. Now, in today's time, as you very aptly mentioned, that people don't go for early diagnosis. They would try to do something at their own end,
Yes.
right? And that's where internet is playing a real big role.
Yes.
All kind of information
Yes. Yes.
that you get on the internet, people build on that, go deep, and then they come to you and then try to consult you,
Yes.
try to tell you, you know, you are wrong, but what they know is right, right? So how do you deal? So firstly, is it right? Is it wrong? What should one must do? And then how do you, as a doctor, deal with such patients who basically have a, for a lack of a better statement, a wall around their brain? Logic doesn't get in
Yes.
because they've already consumed a lot of logic, which as per them is reality.
A lot of the world today is turning to the internet for information
Correct.
and seeking advice. So there are a lot of doctors sitting on ChatGPT. So,
Correct.
so they assume that okay, this ChatGPT, this AI tool is going to help me because it's like a big search engine that's going to help
Correct.
me. You know, it's going to search from every
Yeah.
portal and then it's going to help me give me the answers that probably this doctor would also not know. So jumping to such conclusions is not right. These doctors, all of us have had extensive medical training. We've had our education, we've trained in these particular fields. Only then we advise patients on that. Now, unless I actually have a training in proctology, I'm not going to go and tell someone or advise anybody.
Absolutely.
I've had my training in proctology, which is why I can help them in the best possible manner. Such a scenario is not going to be helpful with the internet. People need to understand this. Till some point, I believe you can use the internet, but if you are constipated, definitely people are not going to just jump to a doctor. Okay, I have constipation. What do I do? Especially if it's the initial phase. If it crosses a barrier, say it's 4 or 5 months, and it's causing them a regular discomfort, then definitely they're going to come up to a doctor. But in the initial days, they don't do it. They consult the internet. But yes, it is the reality.
Yeah.
They consult internet and then it's either the internet or they just go on any of the search engines and then they'll just type out what we can do. So there is right and wrong information out there.
Absolutely.
And it's not very easy for patients to actually realize which is the right and the wrong information. So that correct advice will be given only by a medical professional, which is why if they are suffering from anything, either consult a medical professional immediately, or if you have someone known, then definitely reach out to them.
So they come to you,
Yes.
right? And the diagnosis starts. So now let's go and talk about the diagnosis. You are working in the laser proctology. That's your preferred specialty. That's your sector. Then there are traditional methodologies.
Yes.
So number one, what is the absolute difference? And number two, why did the advancement happen? Why people want to go away with traditional surgeries and focus more on these modern methodologies?
Okay, well, this is a good question. Think of traditional method as a knife being used. Okay.
Ouch.
And
Pains already.
yes. Then there is stapler, which is used in proctological conditions.
Okay.
So stapler is basically like a butter knife. Okay. It's not that sharp. It's going to help you. It's going to reduce the operating time, but again, going to give you that discomfort. Okay. Laser is like a fine-tipped pen. Okay. So this is like a big difference that has happened. So in the initial days, there was more bleeding. There was a big wound that was left behind.
Yeah.
Surrounding tissue damages more. So your body has to go into a shock and repair mode because it has to repair a lot of things then. With laser, it is a pinpoint, precise, clean surgery. With this, there is no surrounding tissue damage. There is no excessive inflammation. There is no massive bleeding. There is no open wound. Okay, there is no pain post-operative of the wound. I'm not talking about the surgery that has been done, but of the wound because there is no wound there.
Correct.
So these surgeries, they help the patient massively because they can be discharged from the hospital quicker. They can go back to their routine life. They can go back to your work. So every person is just adapting to this because in today's world, nobody wants a downtime. Everybody wants a very fast life. Like, okay, it
Correct.
has to be done quick, it has to be done
Correct.
perfectly. So
Yeah.
they want less of a surgery but more of a repair job. That is how that is how they think, and that is how the world is transforming. Now, for us as doctors, these minimal access techniques have been extremely helpful because first of all, they are way gentler on the tissues. It's a clean surgery. There is more accuracy and there are better outcomes. So that is an advantage for us. Advantage for the patients are a lot more because in the end, obviously, it becomes less expensive. We'll come down to this.
Yeah.
Why I say laser is less expensive. So it's less expensive. There's less hospitalization. Patients, either you can do a daycare or just 1 day hospitalization and then you can just go back home. They return back to their normal routine. There's no bed rest.
Okay.
There's no bed rest. People in today's world, definitely post-operatively, you should not be on the bed, especially who's been operated for proctological conditions. No, you have to walk around. You have to get back to your daily routines, and you can do that the very next day. Within 48 to 72 hours, these working professionals are going back to their working routines also. They're not taking that big leave, which is good for them. Because, yes, obviously, because the less leaves that they put is good
For them.
for them as well.
Correct.
So it's an advantage on both the ends, on the doctor end as well as on the patient end.
One is, of course, the entire cost of the
Exactly.
surgery itself,
Yes.
of this whole procedure. One is like the absolute cost, right? So
Yes.
we'll not get there. We've got insurance and all of that. So that's very subjective.
Yes.
But yeah, let's talk about the overall expense.
Okay, so any recent development that happens, okay, people jump to the conclusion, oh, this is going to be very expensive.
Absolutely.
It's with every technology,
Absolutely.
not just in medical
Yeah,
field.
correct.
Anywhere else, you even go buy headphones. They say, oh, it's a recent technology. It's going to be more expensive.
Expensive. Yeah.
Why is it expensive? It's got some reason to be expensive. Now, laser, when they say laser surgery, you cannot just calculate the cost based on the laser that is being used. You have to look at the entire scenario. Okay, so patient's cost is based on the surgery, based on the hospital stay, the medications, everything. Okay, so in total, if we are sending the patient home the very same day or the next morning, the hospital stay is going to be less, the medications used are going to be less,
Correct.
the follow-ups are going to be less, recurrence rates are less. So because of all this, it is not expensive. It is definitely cheaper than the traditional ways that we've been operating. Yes, because in traditional ways, there's a wound, so patient has to come back again and again for a follow-up. And even if it's not a follow-up from our side, they come to us, okay, there's pain, there's burning sensation, there's
Restricted movement. You can't move for some time.
movement. They have to again and again ask for a leave from their work because there's no confidence at work also. They're not able to focus. So when all this is happening, if you look at the complete scenario, this laser surgery has changed the entire game.
Correct.
So people, when they assume, oh, it is expensive, no, if you look at the complete picture, it has given you, it is like a blessing that has been given to everyone because it's less expensive than everything else.
Uh, the cost of this entire procedure, like I said, one is like the procedure itself,
Yes.
but then uske aage, uske piche, whatever a patient goes through. And then before that, we spoke how people sort of build these pre-notions. They'll go on the internet,
Yes.
do search from every possible AI tool that's available at their disposal, then watch videos and, talk to people and all of that, carry that whole baggage, come to a doctor.
Yeah.
Both of these things combined together build a great library of myths.
Oh, yes.
So, what are some common misconceptions and myths that are prevalent, in regular day-to-day patients' lives? And what are some recent myths that you, as a practitioner, are seeing increasing in number?
Myths, I don't think they stop.
as much as you'd
Because-
want them to, but
yeah, because people keep coming up with newer and newer
theories.
myths. Because anything you say can be twisted in a way and
I hear you. Correct.
and made into a myth. Okay, but anyways, it's come down to the most common ones, I'll speak, because there are like n number of myths that go on. Okay, so I had one patient who had come up to me and then genuinely asked that, will this laser burn me? So then I realized, okay, this is the kind of thought process that is out there. Okay, this is probably that the laser that they're thinking,
Correct, yeah.
the regular laser that is being used. So no, lasers do not burn. It burns the tissue that we want burnt. It
Okay.
seals off the blood vessel that we want sealed off. Okay, so there are different functions in a laser. There are different lasers being used. That is a very in-depth medical
Technical,
discussion,
yeah, correct.
but we'll come down to this thing. So there are different ways that a laser is being used, and there is no burning of the tissue. Definitely, as I mentioned, surrounding tissue is completely clean and healthy, and there is no damage to it. So it does not tear off any of the tissues. It treats the tissue. It's a very important thing that people need to understand, that a laser is not going to burn everywhere. It's going to treat the condition right there. Okay. Second thing, you need to understand that this is a very medically formulated laser, obviously with an extensive research being done in
Correct,
this.
yeah.
So it's because it has to be a precise management and precise treatment as compared to say a stapler, which is always like a circular thing. So it's going to cause, yes, it's going to cause an injury to the surrounding tissues. Traditional methods is going to cause an injury to the surrounding tissues. But laser is very focused, and it has been made in such a way that if I'm working on a fissure, I'm only going to work on the fissure. I'm not going to work anywhere else. That is how it is. Second thing, people have come up to me and said that, okay, I am getting my laser surgery done. So this is like once and for all, I am done. Like, no.
Oh, yeah.
Yes.
They think that getting a laser will not lead to a relapse.
There is no recurrence. That is what people assume. But no, it's not like a magical wand. It's not like that. People need to understand that there are a lot of things that has to be managed post-operatively.
Okay.
Okay, so you come with a condition to a doctor. A doctor is going to treat that condition. But what happens after that? It's not like we have completely closed off all the vessels for you that not to form another pile. We've closed off your anal canal. No, obviously, we are repairing and treating the condition that you've come up with.
Yeah.
But post-operative is the patient's role now, because there has to be a lot of lifestyle changes. There have to be a lot of diet changes that they need to take care of, because a lot of people then they come back after say 5 years, 6 years, that, oh, I have another pile now. But why did it happen? It's not like something 5 years ago a surgery was done and now it's going to cause you an effect. Definitely not. But what happened in between those 5 years is the understanding of the patient that I need to change my lifestyle for this never to happen again.
Correct.
That's how. So I had a 26-year-old IT professional come up to me, and as soon as he entered the room, he's like, I know what I have and I need to take care of this, and I need you to help me with the da-da-da conditions. And he came up with his CT reports, his MRI reports.
All done previously?
All done previously. And then I asked him, who asked you to do all this? Did you consult someone else? Was there another surgeon involved? Because obviously we need to know all this. So he came up with all the reports, and I asked him, who did you consult to get all these investigations done? Is there another surgeon involved in the picture? Do we need to know? He said, no, I got it done. So I asked, like, where did you get it done from? And who asked you to do it? Then he said, ChatGPT. So people come with these searches, and then he had a case of complex fistula. And then he just demanded, I want to get a laser surgery done. I tried to explain that, okay, in complex fistulas, laser is way too complicated. There will be a higher chance of you coming back because we'll have to repeat the surgery.
Correct.
But he was very adamant that no, I've done my search online. I've read through every possible scenario and I know laser can be done. I said, I never denied laser cannot be done. It can be done, but you will have to come back because it has to be a repeated session. But again, such people come up, and it's very important for people to understand that laser is not for everybody and everything. It's not for that.
Correct.
Because when you come up with a condition, a disease to us, you should leave the decision of operative, how we want to operate, to the surgeon.
Of course.
Yes.
Of course.
Now, there are certain people who come up saying, okay, no, I just want the laser to be done. That's it. Anyhow. Or I want a stapler surgery done. But again, it has to be a decision of the surgeon because it's going to look at the complete picture, the anatomy, severity, what grade of the disease are you at, what is your current condition. Based on all that, he has to take a decision how we should even proceed with the surgery. Because people are, it's very difficult for them to understand that if there's a recurrence of a fistula, if there's a recurrence of the piles, using laser again and again is not really a good option. So then we have to take up another measure because obviously we have to solve the problem, not make sure you come
Correct.
back to us again and again.
Correct.
So we want to treat the problem, not get you back with the same issue. So people should understand that lasers are used in certain conditions, but in certain situations we cannot use it. So we're going to give you the best advice possible. We're not going to ask you, okay, we're going to make a big cut, leave you with a wound, and leave you with a big problem for 2 to 3 weeks. No, we're going to give you the best advice possible, and we're going to do the best surgery possible for the patient. That is how we work. So it has to be an understanding between the patient and the doctor that, okay, this is how we're doing, and we're doing everything good for you.
Correct. Yes. So before moving on to the next segment or the next set of topics that I'd like to cover, Dr. Simran, I want to just extend this current conversation that one of the myths also could be, and I'm certain it is, about the side effects of the laser surgery.
Okay.
Right? So, what are the side effects? What can go wrong? Not only of laser, but also the other traditional methods.
So again, as I mentioned, the traditional methods will leave a wound. Okay. It's going to leave stitches in the area, and it's such a highly sensitive area.
Correct.
Even if you sit, it's going to cause you a discomfort. You won't be able to sit properly. Anytime you pass motion, it's going to cause a friction.
Correct.
It's going to give you the burning sensation because nerves are exposed. So anything rubbing against an exposed nerve is going to give you the pain and the discomfort.
Correct.
So this is like a biggest side effect, and these things don't solve for 2 to 3 weeks.
Oh God,
So yes, so it's a long journey in a traditional method. Then there was an advancement. We could move down to stapler surgeries. Staplers, yes, it definitely reduces the operating time.
Is it like a stapler, like a literal stapler?
No, it's a circular stapler. So what it basically does is we have to insert it into the anal canal and wherever the pile is. So then we tighten it around that segment and the entire mucosal segment is brought out.
Pulled out.
Yes. So it's like a donut that's brought out.
Oh.
Okay. So obviously it causes an anastomosis. It joins the two ends inside, but there is a stapler and there is a big incision, circumferential incision, which has been joined. So now around the circumferential incision, you pass tool, again,
It's going to hurt.
It's going to hurt. Because you're cutting something and the stapler is helping you join it.
Join it.
Okay. So that joining again, there is a break and join movement in your body. So your body is going to repair it. So in that repair, there is going to be an inflammation. And whenever there's a stool that is being passed through this inflammation, it's going to cause that discomfort.
Absolutely.
Definitely lesser than an open wound. Because there is an exposed nerve. So that pain is going to be more. So this is a discomfort, but definitely a pain. Now when you come down to laser, it is not causing any of the surrounding tissue damage. So it's only the fissure that we're treating. But again, there can be certain bleedings post-operative, but it's not going to be a massive bleed. You'll probably see for the next 2 to 3 days if there is like 2 to 3 drops of blood. That's it, not more than that. But again, after operative, it's very, very important for patients to understand about hydration, to understand about their lifestyle changes, because you cannot sit for a long hour. You're going to cause a relapse of everything. It's very important for them to change their dietary habits. If you go down to the same junk food, constant maidas and masalas and everything, you're basically going down the same path.
Correct.
So again, it's going to take 2 to 3 years for it to develop, and then you're going to come back with the same thing.
This entire subject of, you know, the just the thought that someone can or already has developed piles or fissures or fistula, then developing the whole disease, then the whole diagnosis, and then the post-diagnosis, post-operative journey, right, to recovery. This comes with a lot of weight, and I'm saying emotional weight, right? There's
Yes,
a lot of
definitely.
emotional, because we, and especially in India, right, हम लोग उसको बहुत embarrassing सा समझते हैं.
Yes, of course.
बचपन से ही
Some people consider it as a taboo also to even talk about it.
Correct. So, medically, of course, it is just a biological, physiological problem. हमारी body में और भी problems होती हैं. This is like one of those problems जो हमारी body में हुई, हमने उसको ठीक करवाना है.
Yes.
But what happens? How do you handle, how do you deal, or how do you sort of consult patients who come with this emotional baggage और इस embarrassment का notion कि यार नहीं मुझे क्या ही हो गया, मैं बात कैसे करूँगा, किसको कैसे बताऊँ? Because that, correct me if I'm wrong, that will also lead them to not recovering faster because
Yes.
they're stressed, right?
Because they're stressed.
Yeah, so-
Exactly. So such people, we've come across a lot of people who come with stress कि मेरे को पिछले 2 साल से ये problem है.
Correct.
But I didn't know how to approach a doctor. I didn't know, first of all, they don't know whom to consult. Then when they even realize, okay, we have to consult, say, a surgeon. Okay, because if they go to a general physician, obviously then there's going to be references.
Correct.
They'll be sent, eventually they'll be sent to us. Okay, so such people, they come with a lot of stress, with a lot of embarrassing situation, that even at work they're not able to sit for a long time, especially when they have to sit in meetings, like long meetings, and there's a lot of discomfort.
Correct.
They're not able to focus, not able to pitch in for their work.
They don't have confidence.
Yes, of course. They lose a complete confidence.
Correct.
And this thing is a lot more in women. So
Oh,
yes.
I thought it was men who were.
With females, even if they're sitting at home, and if they have a work from home situation, or if they're at their workplace, so it causes so much discomfort that they're not able to face even their colleague, and they don't know how to approach with this topic, because it's somehow they feel that they are ashamed to even speak about it, that okay, I'm bleeding in my stool. I saw a few drops of blood in my stool. They think, how do I even talk about this? But then again, to whoever is going to listen to this podcast, I really want to reach out to them and make them understand that this is not a character flaw that anybody is talking about. This is a medical condition, and we as doctors, we are trained to help you in this.
Get out of it, yeah.
Yes, to help anybody who is in need of this. So definitely they should not feel shy, they should not feel embarrassed by this. If you have a cut anywhere else on your body, you're definitely going to go seek medical help. It's a similar situation.
Correct.
Yes, the area is different, but no, it's your own body and you need to take care of it. The faster you come to us, the faster we'll be able to help you get out of it. And if you have like small changes done to your lifestyle, so it's going to just help you in the massive way. If you change, if we help you, we let you know, okay, your dietary habits are not right. You've come to us with a 6-month long constipation. Your dietary habits are not right. And we help you prevent the piles that was developing. We help you with a fissure, which is not going to require any surgical management. But yes, with a medical management, with just a conservative treatment of 7 to 14 days, we help you. definitely that patient is not going to require any surgery. He's going to go back happy that, okay, all I had to do was change my eating habits. That's it.
Simple as that.
It's as simple as that. So this is something that people need to understand, that it is not really a big issue that needs to be dealt with. But yes, if you're developing anything, you seek medical help rather than just keeping it inside you that maybe I'll help it. This is just going to go away. Nothing goes away by itself.
Correct.
So you need help, you need help. It's as simple as that.
So, Dr. Saab, I want to build on that, right? So, what are some lifestyle changes that are easy to incorporate into our daily life so that people can, focus? So, I'm coming from that whole prevention is better than cure wala
Yes,
philosophy, wherein, thoda sa discomfort at least come ho jaye. So, what are some lifestyle habits that one must adopt? Number one. Number two, early signs, early diagnosis, early visit to a doctor is really, really important.
very important.
How important it is, what it could lead to.
Yeah.
I would, like to know more about it.
So, as I mentioned, if say you have only constipation, or if you have a very recently developed fissure, okay, it's an acute fissure. You come in the early stages to us saying, I have burning, I have itching, and I'm not able to sit properly. And sometimes I see drops of blood at my stool, and they've immediately come to us because whenever they see blood, they go into a panic state. Because if you put it on any online search, blood is equal to cancer.
Cancer.
So they immediately jump to us that, oh no, am I developing rectal cancer? So then that is how people need to understand that not every condition is cancer. But yes, it is a calling that you need to seek help.
Yeah.
So whenever they do, in such a scenario, say you have constipation, acute fissure, can be dealt with a conservative management. You're going to save surgery, you're going to save hospitalization, you're going to save your leaves, the further complete management only and only by changing your lifestyle. Definitely, you're going to require certain medications. You're going to require certain habits that you need to change. Okay. But again, if we come down to the habits that need to be changed, so certain things that help, again, as I mentioned, long sitting is one of the causes for piles. So if you are sitting, there is no escape because it's your work. But if you are sitting for that long, make sure you get up every hour, walk around. There is some movement that is there.
Happening.
Yes. There's some movement because if you're working for 8 hours in a day and you're sitting, after that sitting time, nobody would want to go to the gym and then do everything.
You're already exhausted.
You're already exhausted. You're mentally exhausted.
Correct.
You do not have any more mental strength to do anything else.
Correct.
But your physical body is still weak.
Yeah.
So every hour, make sure you're getting up. You're just moving around in that space. Don't log off. It's okay. Keep your work on. Just walk around in that space. Grab a glass of water every hour so that you can make that habit. You're consuming more water with it. Don't pick up the bag of chips. Pick up something else.
My God, that's so difficult.
Yes.
So difficult to do.
It's very important because these are very small things, but it's going to help you in the biggest possible way. So this is how people need to understand that, okay, if I'm just going to get up and every hour grab a glass of water, that will help me, okay, because I'm going to consume more water that way. You're consuming more water, so subconsciously you're like, okay, you're taking in more fluids, you're hydrating yourself well.
Correct.
Then if you're eating, make sure you're not eating at the very same desk that you're working at. Because people have a habit, they just bring their food to that table, your desk, and then you're eating right there. So again, you're sitting. Walk, go to your living room, consume your food there. So then again, you're going to have some movement. Spend a couple of minutes with whoever is at home. So you have your family, your pets, whatever. So just spend a couple of minutes there. Then come back to your desk. So you're going to have that movement. So slowly these changes will just incorporate in your brain, and that is how you will start doing it on a daily basis. So you're not going to sit only for 8 hours. You're moving around. You're doing everything. Even if you're at office, it's not the olden times that, oh, you cannot leave your desk.
Yeah.
No, definitely. People are moving around in their office. They're doing everything. After every 1 hour, just get up, walk around, go talk to your colleague for 5 minutes, come back.
Yeah.
It's good enough for that. Then second thing, they need to make sure that their eating habits are good. So as I mentioned, you need to have a good fiber intake throughout the day. Okay, if you are consuming something unhealthy, make sure you are having a bowl of salad with it. It's
Again,
very difficult, but
Very difficult.
it's very difficult.
Too difficult.
But yes, you need to make sure to do that. Okay, if a lot of people, I see a lot of gym rats who,
Oh, that's a good term.
yeah, a lot of gym rats who are like coming up and then just saying, oh, I consume so much protein supplements and I take whey protein, I take this, that, as the additional supplements. For someone who actually needs the additional supplements, yes, we definitely recommend an additional dose of supplements. But what happens with these proteins is very difficult for your body to digest. Okay, so the higher you take it, your GI motility is going to reduce. If it is reducing, again, you're developing constipation. Then you go back into that cycle. So a lot of these gym freaks, they come to us saying, "Oh, I'm constantly constipated. I am taking proteins. I'm taking this." But with protein, again, your hydration is reducing. It's very difficult to digest the complete protein intake that you're taking, and you go down to the same track that okay, constipation, and then again these conditions. So you need to understand how much protein you're even consuming, if you need to take it on an alternate day basis, or do you actually need it or not. So that is how it happens. So these are certain habits that people need to incorporate in their daily lifestyles to just change it. And these are very small habits. It's not like a very big demand that you need to change. Well, for salads, I can understand.
Very demanding.
For salads, I can understand. But there are obviously so many alternates.
Correct.
Rather than taking chips, you can take makhanas. You can start consuming that. You can take black chana. You can, the roasted chana that you take. You can start consuming, munching on that. Rather than just consuming these energy drinks, you can switch to maybe a few healthier options. So, such things, it's just a couple of changes that you need to take to avoid all the fuss of surgery. So again, it's a very small thing, but people, when we actually tell them, okay, this is the only thing you need to do to make sure that you're not going to a surgical table, so they get very happy and they're extremely happy to even leave the OPDs. That okay, this is all I have to do, and then 7 days later, when they come for a follow up, they are super excited that okay, I do not have any other complaints now. All of my complaints have been gone. They're passing motions well, there's no more bleeding, there's no more burning, there's no more itching, nothing. So it's very good.
Yeah. So one last question, Dr. Simran, before I thank you for your time. There is a very high possibility that there are people who may land upon this video.
I hope so.
Yeah. They most certainly will. And this may connect with them. उनको भी शायद ऐसा कुछ ना कुछ discomfort हो रहा होगा, कुछ signs and symptoms होंगे. But they just don't have that confidence to go and approach a doctor.
Right.
Out of whatever reasons, right?
Right.
What is a message to them? What would you recommend for them?
To such people, I would say that the world is advancing. Okay. There are a lot of techniques that are coming up. It is not the olden times. And it is definitely not a taboo. You don't have to be shy to talk about these things. You don't have to be embarrassed to approach a surgeon, a doctor with all these complaints. We've been trained to treat you in these medical conditions.
Yeah.
We're not here to sit and judge anybody. We're not here to make them feel ashamed about any of the situations. We're here to help you. So, if anybody is going through any of these conditions, definitely reach out to your closest doctor. And as and when needed, if they feel you need to be referred to a surgeon, or if you can directly approach a surgeon, it is really good. Because, as you said, prevention is better than cure.
Correct.
So, it's very important. I mean, I don't think every patient needs to reach the surgical table. If we can deal with them with only a conservative management, they're going to be happy. We're going to be happy that the patient is happy. And that is all we look for. That's it.
Yeah, and if I may add one more line to that, don't look at the internet.
Don't look at the internet. Yes, please. Don't look at the internet.
That's going to confuse you all the more.
Yes.
Great. Thank you, Dr. Simran. This was a lovely
Thank you so
conversation.
much.
Thank you for your time.
Thank you so much.
Really learned and understood a lot about proctology and laser proctology and all of that. So, thank you. And I look forward to the next one where we will go a little deeper into particular case scenarios
Yes.
that again may help some of our viewers and listeners.
Of course.
Thank you so much.
Thank you.
Thank you.